Alright, so right now we'll be discussing secretory or stimulant expectorant. That is the first category of expectorant. In the previous lecture, we discussed the various classification of or the overall classification of expectorants. Today we'll be starting with the first category of expectorant, that is secretory or stimulant expectorants. Okay, so since these are expectorants, so their function will be the same no matter what category of expectorant that is. That the drug will perform the same function, that it will increase the fluidity and volume of the secretion in the respiratory tract. Okay, so but there are different mode of action. So with respect to secretory or stimulant expectorant, there are two mechanisms of action or two modes by which they act, that is direct and indirect. Okay, direct and indirect. So if we talk about direct, then they act on submucosal gland. So what direct means, these drugs will directly act on submucosal gland, and indirect means they will act on they will act on the stimulation of gastropulmonary vagal reflex. Okay, so we'll discuss what gastropulmonary vagal reflex is in a minute. So that is a indirect and indirect mechanism of action. Okay, so now we'll discuss types, the subcategories within secretory expectorants or stimulant expectorant. First is reflex acting. So reflex acting, how can we define them? These are drugs of plant origin which are used as expectorant at lower doses. Okay, so reflex acting secretory stimulants are the drugs of plant origin which are used as expectorant at lower doses. Okay, so mechanism of action is, their primary mechanism of action is by acting on the gastropulmonary vagal reflex. Okay, their primary mode of action is to act on or to stimulate the gastropulmonary vagal reflex. Okay, so what is the meaning of gastropulmonary vagal reflex? As it is written here, gastropulmonary vagal reflex. So gastropulmonary vagal reflex means no matter what the expectorant is, it has a property. All expectorants have a common property, that is they irritate the mucosa. Okay, so they will irritate the mucosa. So when that expectorant will be administered orally, when that particular animal, we will be providing that expectorant in the feed of the animal or water of the animal. When that expectorant will enter the GIT, then that expectorant will irritate the mucosa of stomach or GIT, and that will lead to the transmission of sensory or afferent impulses from the stomach to the CNS, and then transfer of motor or afferent impulses from CNS to the effector organ, that is the lungs, and through vagus nerve, and that is why it is called gastropulmonary vagal reflex. Okay, so now mechanism of action of reflex acting. So the reflex acting secretory expectorant, they produce or increase the stimulation to vagus nerve. Okay, this increased secretion to vagus nerve leads to the production of reflex secretion by tracheobronchial glands. Okay, so that is the basic thing. So when this gastropulmonary vagal reflex will be activated, this will increase the secretion of the tracheobronchial glands. Okay, so this is the mechanism of reflex acting secretory expectorants. Okay, now we will discuss the drugs under secretory expectorants, reflex acting secretory expectorants. So first is ipecac or ipecacuanha. Okay, so ipecac, also called ipecacuanha, is obtained from the plant Syphilis ipecacuanha. Okay, this is H actually. Okay, this is actually H. So now uses. So now see, we have studied, we have read the definition of reflex acting stimulants, that stimulant expectorants, that these actually function in the way that they will act as expectorant in the lower doses. Okay, at lower doses. So that is what is written here in ipecac and ipecacuanha or ipecacuanha. At lower dose it will act as expectorant, but in higher doses it will act as an emetic agent, that is vomiting inducing agent, nausea inducing agent. So that is not of our interest today. That is in the digestive pharmacology, GIT pharmacology, but here we have expectorant. Okay, so at lower doses, ipecac or ipecacuanha will act as expectorant. And what is the mechanism of action? So since these belong to reflex acting secretory expectorant, so their mechanism of action will be the same for all, no matter what reflex acting secretory expectorant that is, its mechanism of action will be the same. Okay, so mechanism of action is that it stimulates the secretion from the respiratory tract by reflex action mediated by ANS, especially vagus nerve. Simple. What am I trying to say? I'm trying to say that mechanism of action, it stimulates the secretion from respiratory tract, the same which we have studied with respect to the general mechanism of action of reflex expectorants. That is, this drug ipecac will act on gastropulmonary vagal reflex, that will stimulate that, and this gastropulmonary vagal reflex stimulation will actually in turn stimulate the secretion from tracheobronchial glands. Okay, that is the thing. But this is less used in veterinary medicine. No reason, I don't know why. But these are the dose rates. So important, we need to learn, but we can just mug it up. We cannot do anything in dose rate. Okay. Alright, let's move to the other drugs. Next we have balsam of Tolu or Tolu balsam. Okay, so it is obtained from a plant that is called myroxylon balsamum. Okay, myroxylon balsamum. So its mechanism of action is as follows. It induces respiratory tract secretion by two mechanisms. Okay, there are two mechanisms by which it induces respiratory tract secretion. Okay, the first is main mechanism of action. Second is also the secondary mechanism of action. So main, since it belongs to reflex acting, so it will induce the expectorant effect by inducing the gastropulmonary reflex, vagal reflex. Okay, but it also acts on trachobronchial glands. It also acts on trachobronchial glands. So that is another thing. Okay? And this point we can remember that balsam of Tolu is a common ingredient of cough syrup. So they might ask in the MCQ that which drug is the common ingredient, what is the common ingredient of cough syrup with respect to expectorant, that is balsam of Tolu. Okay? This is the dose rate. So we have to learn this no matter what. So this is the dose rate as you can see. Now, second subtype of secretory expectorant, we have direct acting secretory expectorant. So direct acting, as the name itself says, they will act directly. They will act directly. What it means? It means that these direct acting secretory expectorant, they will directly act on the tracheobronchial glands and increase the secretions from those glands. Okay, and that is they will produce an hyperemia, and they will produce a hyperemia in the respiratory tract. Okay. Okay. So now we'll move on to the drugs under direct acting secretory expectorant. So first is guaiacol and guaifenesin. Okay. So guaiacol and guaifenesin, the first point which you need to understand is we are talking about guaiacol specifically, not guaifenesin. So guaifenesin, as written here, it is main uses of guaifenesin is as a central muscle relaxant. Okay. The main use of guaifenesin is a central muscle relaxant. So we will not talking about guaifenesin specifically. As you can see, dose rate here I have written for guaiacol. Okay. So now guaiacol. So direct acting, they will just act just like that of direct acting secretory stimulant. So they will increase the production of, they will directly act in trachobronchial gland, they will increase the production of mucus, they will cause the hyperemia in the trachobronchial tract, respiratory tract, and they will increase the production from trachobronchial gland, direct stimulation. Okay. So this is what guaiacol does, and that is written over here. Increase the bronchial secretion, increase the mucosal ciliary reaction, reduce the stickiness of mucosa and chronic bronchitis. We can learn this, but the main thing is this. So because guaiacol is included in direct acting secretory expectorant. Guaifenesin, as you know, is a central acting muscle relaxant, and dose rate for guaiacol is this for dogs, cattle, and horses. We need to learn this no matter what. Okay. Next we have volatile oil and balsamic resin. So volatile oil, mechanism of action is again same. They will act on tracheobronchial glands. Okay, they will act on tracheobronchial glands. They will induce respiratory tract hyperemia. Simple. Mode of action. So mode of administration or route of administration, that is oral route occasionally and medicated vapor inhalation mostly. Okay. Now, thirdly we have saline or mixed acting expectorants. Okay. So they mixed acting, so they will act in both ways. That they will act reflexively and they will act reflexively, that is by inducing or stimulating the gastropulmonary vagal reflex, and they will act by directly on tracheobronchial glands. Simple. Mixed. That is why they are called mixed. Okay. So drugs are potassium iodide, ammonium, antivenin potassium tartrate or emetic, tartar emetic, and syrup. Okay. Potassium iodide. So route of administration is oral. Oral means per os, PO. Okay, per oral. We can also call it like that. Alright. So mechanism of action by both mechanisms. So mixed, they will act by both mechanisms, that is stimulation of gastropulmonary vagal reflex and direct stimulation of respiratory glands. Okay. So now this point is important because this can be asked, and when I solved the MCQ, this was asked in that particular MCQ. This was a potential MCQ that was asked. Okay. So potassium iodide is more beneficial in the later stages of bronchitis. Okay, and potassium iodide is not helpful in the earlier stages of bronchitis or in the acute form of mucus production. When there is excessive mucus production, acutely. Okay, why is it so? It is because of the fact that when potassium iodide is helpful in the later stage of bronchitis because it can easily liquefy or loosen the thick mucus present in the later stage of bronchitis. Okay, it will easily liquefy the mucus, but in the earlier stage it will have a more irritant action as compared to other things, as compared to later stages. Okay. Next we have ammonium chloride and ammonium carbonate. So not of importance. So at high doses causes hyperammonemia, it acute pulmonary edema, all of this. So same, widely used in cough remedies. So not of our importance, but this dose rate is very important, and this dose rate is again very important. Okay.